times have you checked your phone during this session? I see no takers, so I will let that go and ask you instead, how many times do you think the average person checks her phone each day? 10? 100? 200? 200? I know what you do for a living. 200? Yeah, people are telling on themselves. I see some spousal issues emerging. Yeah. The answer is 150 times a day. 100, can you imagine? Many of us are like, yeah, I totally can imagine. And you see some of the top reasons listed here. And this is just to illustrate the point that people carry these things all the time. And people who are in impoverished circumstances, who are in medically vulnerable areas, they do this too. And they do this at a high level. In fact, they do this more than we do. And so this becomes an easy way to touch them with these kinds of approaches. And iOTA works. And so I won't spend a ton of time talking about our data, but I do want to present just 2 studies here very quickly. We do all of our work in community health centers. We work exclusively in primary care. And we love community health centers. They are a wonderful national resource. They serve 22 million Americans, working poor, uninsured, folks who are in poverty. We have some of the best community health centers in the world here in Boston. And we did a study called BFIT Be Well, actually based here in Boston Community Health Centers. Let me tell you a little bit about the average BFIT Be Well patient. She was around 55 years old. And she either had her own children or custodial responsibility over her grandkids. She was obese. She was retired or unemployed. She made less than $20,000 a year and had a high school education. And she had hypertension. She often had diabetes and generally had a lot going on. The real difficulty making ends meet. Sometimes homelessness. Folks had a lot going on. And I can promise you that weight loss was not at the top of the list. It was nowhere on the list. We certainly, women in this trial, and we had women and men, but I think about the women, weren't really motivated to lose weight because of kind of aesthetic reasons. That was just not on the radar. And they really weren't motivated to lose weight for health reasons, even though losing weight would dramatically improve their health circumstances. But they just had complicated lives. And so for these women, several hundred of them, we gave half of the folks in this study access to a website. That may seem silly to some of you. It certainly seems silly to a lot of people, at least initially when we first started talking about this idea. How are you going to take women in these impoverished circumstances and give them access to a website to lose weight and expect that it's going to work? That's what we did. And we allowed them to choose between getting access to a website or using a phone-based version of our program. They get a phone call every week. They pick up the phone. It's like they're talking to an airline or a bank, and they respond to some questions, to their iOTA questions, and we give them feedback. And so what happened over time in BFIT Be Well is that women lost weight. They didn't lose a ton of weight, but they lost weight, and they kept it off. What you generally see in most weight loss studies is the most weight loss at 6 months, and then people steadily gain weight back at 1 year. It's a big problem in weight loss is that almost everybody gains weight back. But in this study, people lost weight, and they kept it off for up to 2 years. But that wasn't the most important part. The most important part were the changes in blood pressure. You see the blood pressure findings for our participants in the intervention group in the red here. And in the blue, you see people who got usual care. Usual care in this study meant that they just saw their doctors as they normally would. And what you see, generally speaking, for people whose blood pressure is not well controlled is that their blood pressure just goes up year after year after year until they start to experience cardiac events. But people in the intervention group who got this web-based, phone-based intervention, their blood pressure stabilized, and it stabilized for 2 years. We saw lots of other important outcomes, better hypertension control, better medication adherence for all of their medications, and trust me, there were a lot of them, better improved sodium intake, and increases in physical activity. So this really worked, and it was very inexpensive, and people enjoyed it quite a lot. That was one of our bigger studies.